95% of the patients that came in for this had the same presentation, the same response, that we're starting to think, wow, this condition might be grossly overdiagnosed. My name is Dr. Caleb Slater, and I'm an orthopedic specialist in the medical field of physical therapy.
What is Crohn's?
Crohn's is supposed to be an autoimmune condition where your body has an abnormal response in attacking itself, specifically the GI tract.
And what's the traditional treatment method for Crohn's?
The traditional treatment method of Crohn's is basically managing it with medication. So there isn't treatment. There is only management of your symptoms with medication like prednisone, biologics like Humira, Skyrizi, Stelara, Entyvio.
And what's the traditional diagnosis method of Crohn's?
There is no traditional diagnosis of Crohn's. There's no specific test. There's no absolute positive finding that would confirm or reject Crohn's. It's based off a multitude of factors. It's your familial history, your personal history. Does your family have Crohn's, a family member? Do you have genetic predisposition to having Crohn's? It's your symptoms. Do your symptoms fit the diagnosis of Crohn's? Are they able to exclude other conditions like an infection or ulcerative colitis or other similar GI-related issues? And then if they can't exclude Crohn's, if they can't confirm it with another diagnosis, if they see some inflammation on imaging, like an endoscopy or an MRI or CT scan, basically if they have no other box to put you in, they diagnose you with Crohn's.
So, as a physical therapist, how are you qualified to treat Crohn's?
Most physical therapists wouldn't be qualified to treat Crohn's because under the lens of an inflammatory GI condition, right? But if you look at the symptoms and you explain them as a nerve issue stemming from a problem at the spine, then anybody that's an expert in treating the spine would be able to treat Crohn's symptoms, if not Crohn's.
So then, how is the spine and the GI system connected?
So there's really two main areas of the spine that correlate to your intestines and your stomach. And one area is your mid-thoracic spine, somewhere around T5, to your upper lumbar spine, somewhere around L2. And through these innervations, they innervate the entirety of your intestines and your stomach. There's another nerve though, a cranial nerve, so a nerve that comes out of the brainstem called the vagus nerve, that actually has innervations to the intestines and control over the parasympathetic nervous system. This basically acts to control the motility of your GI tract, of your intestines. So if this nerve is impeded, it leads to decreased motility of the intestines. It leads to food and waste sitting in your intestines for longer than it should. This leads to bacterial overgrowth, leads to inflammation, can lead to other conditions like diverticulitis. So a nerve issue, specifically a pressure on this nerve, can lead to a lot of the same symptoms of Crohn's. It would present with nausea and vomiting, constipation. It could present with diarrhea as well, present with bloating, abdominal pain. So any of these regions being affected, or all of these regions being affected, would present with the same symptoms of Crohn's.
So how did this treatment philosophy come about?
This was honestly an accident, this finding. So there's a group of the medical field, physical therapists that are certified in McKenzie physical therapy. Robin McKenzie was this physical therapist in the 80s who basically pioneered treating disc issues. So treating spine problems. And from treating these spine problems, he realized that a lot of other conditions that were getting labeled as local problems, like a hip pain, a knee pain, a foot and ankle pain, shoulder, elbow, wrist, a lot of these conditions weren't actually coming from those areas. They were coming from the spine, And the area that correlates in the spine to these regions, so the area of your neck that correlates to your shoulder, was actually the problem, and you were getting symptoms in your shoulder. You were going to doctors or physical therapists or chiropractors, and they were looking where you had symptoms. They were looking at your shoulder. And the treatment wasn't really working. The treatment, or maybe it would work a little bit, but it wouldn't work completely, or wouldn't work quickly. And we realized that we're treating the wrong area, and it was a spine problem all along. So these therapists treat more like this than anything. And I became certified in this as well, among other orthopedic certifications. And it was kind of by accident and over time that we realized that if a spine issue can be the cause of your knee pain and get misdiagnosed, why can't it be the cause of your abdominal pain and be getting misdiagnosed? And a few years ago, I had a friend that had some difficulty breathing. And he went through all the normal processes. You know, he went to the hospital, he went to the ER, he went to his primary care physician, he went to the pulmonologist, and nobody was finding anything, but they kept labeling him with asthma, exercise-induced asthma, even though when he exercised, he actually felt better. They were referring him to a cardiologist, and then finally I said, let me take a look, maybe there's something on your spine that could be causing this. And we found it, and as soon as we worked on it, he immediately sat up and breathed better. Then, that could have just been a one-off, but then it happened again with another patient with the same similar presentation, and this patient was actually living in California, so a different state, and we were able to treat her via telehealth. And now we're sitting there thinking like, man, we have something. We were able to fix two people that were diagnosed with asthma, having symptoms for months to years, no response in treatment, multiple physicians telling them that they had this condition, and they ultimately didn't, and we were able to help them relatively quick just by thinking, hey, it could be a spine issue. So if that's the case, maybe the spine issue is getting misdiagnosed in other areas, and somebody happened to overhear this and say, I have Crohn's, could it be Crohn's? And I said, I've never tried this before, but I would give it a shot, and I evaluated her like I evaluated everybody else. She had been diagnosed with Crohn's, I think, around 17 years old. She was about 27, so 10 years. She had been hospitalized multiple times, multiple bowel obstructions. She had been on multiple medications and had been on Humira for the last 5 years, increased to once a week, which is more than normal taking this drug. And within 5 weeks of working with her, after we mapped out her symptoms, after we evaluated her movements, after we looked at her spine to see if the areas of her spine that innervate her intestines were the problem, after 5 weeks of working on these areas, she was almost 100% better without telling me. She had stopped taking this drug that she'd been taking once a week for the last 5 years, and she remained symptom-free since that time. And I'm a pretty skeptical person. If you wanted to categorize me, it would be a pessimist. And my dad used to say, believe nothing of what you hear and half of what you see. And I probably take that a little step further. So I'm thinking, all right, well, maybe this is just a one-off. Maybe she's in remission. Maybe she was misdiagnosed in the first place. So I waited about a year to see if her symptoms would come back and how she would do. And they didn't. And she was back to working out without issues. She was back to drinking without issues, drinking alcohol. And her symptoms didn't return. So now I started getting a little bit more comfortable saying, all right, well, maybe there's other people out there, just like with the asthma. Maybe there's other people out there. So we started talking about it a little bit more and slowly started getting some more patients in, and they were having a pretty similar response. The same areas of their spine that correlate to their intestines were stiff, tender, and when working on them and then showing them how to mobilize them and take pressure off the nerve, restore the nerve signal, they were getting the same recovery. And it got to the point where it was basically, 90-95% of the patients that came in for this had the same presentation, the same response, that we're starting to think, wow, this condition might be grossly overdiagnosed. And the problem in treatment, there might actually be not just treatment, but a cure for a lot of these people because of it, because they were wrongly labeled.
So now how confident are you that your treatment approach works for this?
I'm confident that it works, but on each patient that I evaluate, I go in with a blank slate. I don't go in expecting to find anything. I don't go in expecting for them to have a response. I wait to be surprised. I wait to be surprised by what they say. I wait to be surprised by the area of their spine that is tender or how they move. And then I wait to be surprised by how they respond. Again, I've worked with people that they try to like incept, a better feeling into their patients. Like, oh, you're going to feel so good, or didn't you feel good after last visit, or some similar verbiage like that. I don't want to lead anybody anywhere. It doesn't serve me to have the patient falsely, feeling better, basically that sugar pill, right? So I know this treatment works. I know that I've had people that have had lifelong medication that had no hope of recovery, that had life-altering symptoms completely go away, get off medication, and now living a quote-unquote normal life. But I don't think that this works for everybody. I know there's people out there that either this treatment wouldn't work for, or that maybe they do have an underlying autoimmune condition that needs some type of medication, maybe in addition to treating some supplementary symptoms coming from their spine.
So what would you tell someone who was recently diagnosed with Crohn's?
Well, let's say this. If I was recently diagnosed with Crohn's, before starting strong medication that can mess up your system, that can mess up your gut, your microbiome, your gut flora, can cause a whole host of other problems, can lead to bleeding and pain and reliance on medication. Before doing that, if you had the time and the money, I would spend 4 to 5 weeks on getting your spine properly evaluated and treated to see if you responded to this treatment. Because if so, then there's very likely a cure for your symptoms rather than just management. A cure that doesn't rely on medication, a cure that doesn't really have many, if any, side effects, and one that you're able to take into your own hands and apply to yourself and maintain throughout the rest of your life.
Are there other people who treat this way?
To my knowledge, there's really nobody else out there that treats this way. Like I said, it kind of came to it by accident. Slowly over the years, we would hear patients say when we're working on their areas of their spine that some of their symptoms would be changing that we weren't treating, like their acid reflux, like their brain fog or their dizziness. One of them would be constipation, but you didn't necessarily correlate this together. Again, they were few and farther between. Most shoulder patients aren't talking to you about their constipation, but every once in a while you hear it, and it was so infrequent that you didn't really group it well together. And then again, treating this first patient, it was just luck and opportunity that kind of came together, and the fact that she responded so well. If she didn't, I probably wouldn't be here talking about this. So unfortunately, I don't know of any other physical therapists that treat like this. I know there's chiropractors out there that have a pretty similar view in the sense of their spine can cause all of these issues, but their treatments differ. I mobilize, manipulate, so I crack your back like a chiropractor would. I don't do it to every patient, but I do it to a good amount of patients. But for my purpose, that's kind of palliative. It's passive. It makes you feel good. It makes you feel better in the moment. But if you didn't do something to maintain that improvement, to maintain or improve on the range of motion they created, to strengthen in the area that you need to strengthen in that you were weak, to keep your spine mobile in that direction, then it's just going to come back. And unfortunately, not to throw shade on chiropractors, but most of the time chiropractors, that's where they lack, is they make you feel good in the moment, but they don't really do anything to make you stay better. And that's why so many people out there have been seeing the same chiropractor for the last 3, 5, 10 years.
So what is the downside of going along with this treatment method?
I mean, there's not a lot of downside other than the fact that you consider time, and then to see me, there's an expense. I don't take insurance, and there's no guarantee that it works. I tell people I expect about 50% improvement of symptoms within about 5 weeks. And I'm pretty good at supplying that relief for most people, but again, there's no guarantee. And if anybody does offer you a guarantee in the medical system, they're lying to you and or to themselves. But other than the time and effort that you're going to put in, other than spending maybe $2,000 over the course of these few weeks, there's really not a downside. And if for my money, for my time, for my health, I would absolutely do this before acquiescing to the 4-minute diagnosis that you receive from your doctor that is entrenched in lifelong management of your symptoms via medication.
So why don't you think this treatment method is more widely known?
I'm not sure. I'm not sure why this treatment method isn't more widely known, because what I'm saying is rooted in the medical annals. I wrote a book, a 211-page book, and I have 143 citations in there because I wanted it to be well supported. I wanted it to be known that what I'm saying has foundation in the medical system. But somewhere in the 70s and 80s, we took this hard line to the pharmacological route. We wanted a pill to solve our problems, and that sounds great. And I went down that process myself as well. If I could take a pill that make me smarter, stronger, better looking, sign me up. But I think what we found is that it didn't really do ultimately what we wanted. It wasn't the cure. It was just, for most people, management or masking of their symptoms, which, if you're in pain or you have symptoms, temporary relief, that sounds good to pretty much anybody, but that temporary masking of your symptoms leads to further issues down the line, not only just from complications from the medication, but also from continuing to have this problem that is now progressing. And again, there are people out there that have this view of your spine can lead to all these problems, but the downside is that it takes effort. It takes effort and time on not only your part, the clinician, but the patient's part. And so 5-6 weeks of putting in pretty solid effort, day in, day out, not at the clinic, but throughout your daily life, versus popping a pill and waiting and seeing. And one of them is a lot easier, and one of them is a lot more lucrative.
Are there people that this treatment wouldn't work for?
I've had a few people that, after evaluation, I said that this treatment probably wasn't right for them. One person specifically comes to mind. He was an older gentleman, maybe in his mid-60s. He had multiple surgeries, and somewhere around 10 surgeries for his condition throughout his lifetime. He was on multiple medications and about to start a new medication, peptide therapy, and he was also morbidly obese. And my treatment relies on minimizing your variables and doing a lot of work to your body. And he had been this way for so long. Because of his weight, it would be hard for him to move. Because of his reliance on medication, and because starting a new medication, I didn't think that he was right for this treatment. So I'm sure there are people out there that just don't really necessarily fit. But for the most part, most of the people that I've evaluated have had a pretty similar presentation, pretty similar areas of their spine that are stiffer and tender, pretty similar limitations in ability to squat, bend over. They have some form of hip, thigh, knee, foot and ankle issue as well, some history of low back pain, and those symptoms are some of the first to respond, which typically tells me I'm on the right track.
What is your hope for Crohn's treatment in the future?
I hope to change the face of a lot of treatment for GI issues, and let's say specifically Crohn's. I hope that in the future, when you go to your doctor and you say you have abdominal pain, bloating, nausea, diarrhea, constipation, that after they've done their blood testing, after they've done their imaging, and they haven't found, the quintessential telltale findings, if it's not just quite fitting, I hope that the next thing they're going to say is, let's get your spine properly evaluated, or even if they do find these, let's get your spine properly evaluated before starting lifelong, life-altering medication that just manages your symptoms.